Hello, my name is Gemma Jennison and I work as part of the Community Vision team. I will be delivering today's workshop on child practice safeguarding reviews and the voluntary and community sector. I will now share my PowerPoint with you. This workshop is titled Child Safeguarding Practice Reviews and the Voluntary Community, Faith and Social Enterprise Sector. We will be looking at what we can learn from findings and recommendations from national and local reviews in order to support us to tackle safeguarding issues in the East Riding. As mentioned, my name is Gemma Jennison and I work as part of the Community Vision team as both their domestic VCFSE Domestic Abuse Lead Representative Support Officer and Safeguarding Development Officer. Community Vision is commissioned to deliver both the safeguarding and domestic abuse training and support to the voluntary and community sector. So please get in touch if we can be of any assistance or you would like to join in with any of our multi-agency forums that we run. In terms of housekeeping, this is a huge welcome to the session. This is a recorded webinar and therefore has been recorded in advance of this session. If you do have any further concerns, worries, or any issues that arise as a result of this workshop, please get in touch with myself or your local safeguarding team. You can contact me directly on the email address below, which is gemma.jennison@communityvision.org.uk. Again, this workshop, given that this workshop covers a number of safeguarding issues, we do suggest that you take care of yourself during the session. If you do require any further support, please reach out to myself or your local safeguarding team. And if need be, please feel free to leave this session whenever you wish in order to safeguard your own well-being. So what are child safeguarding practice reviews? A local child safeguarding practice review, also called an LCSPR, is a locally conducted multi-agency review in circumstances where a child has been abused or neglected, resulting in serious harm or death to them, or there is a cause for concern in which agencies may have not acted in a way to safeguard a child. The purpose of a review is to establish whether there are lessons to be learned about the way in which local professionals and agencies work together to safeguard children, where we can identify what needs to be changed as a consequence and improve the interagency working so that we can better safeguard and promote the welfare of children. The statutory guidance for child safeguarding practice reviews was updated in 2018, and you can see this within the Working Together to Safeguard Children document. Previously, child safeguarding practice reviews were also referred to as child serious case reviews. So the information within this webinar is primarily taken from the NSPC learning document titled Voluntary Agencies Learning from Serious Case Reviews. It's going to look at a summary of key issues in learning that has come out of child practice safeguarding reviews across the country and some of the key issues, recommendations and findings that can be used. I will be looking at these and exploring them in relation to the work that we do as voluntary and community organisations across the East Riding. So here are some key issues and recommendations taken for practice. Number one, the key issue is a lack of understanding around child protection rules and procedures. This included voluntary agencies sometimes being unclear or not as confident around the roles and responsibilities that they hold in keeping children safe. It also included staff and volunteers sometimes lacking the confidence, knowledge or skills in recognising and responding to child protection concerns. What was also noted was that voluntary agencies often provide services to adults who are parents. The focus of practitioners can often mean that it's primarily on the adult, and therefore it was recognised that the impact on children and associated children with the individual was sometimes overlooked. Another key finding was that sometimes people felt the loyalty to their local voluntary groups or a sense of gratitude for the support could also mean that they were less willing to report any concerns that they might have around safeguarding practice. It was also sometimes assumed that voluntary groups attached to specific institutions, such as schools, came under the same safeguarding procedures as that associated venue. This wasn't always the case and sometimes led to organisations coming under less scrutiny than otherwise might have been the case. So here are the key recommendations that we can make based on those findings. It's important that all staff have completed relevant safeguarding children and that this covers both children and adults. If you are a voluntary and community organisation in the East Riding, you can contact myself, Gemma Jennison, at communityvision.org.uk, the email address at the beginning of the slideshow, and we will come out and deliver a bespoke training package to your staff, volunteers, paid and unpaid, covering all elements needed in order for you and your organisation to safeguard children, young people and vulnerable adults. A further recommendation was that all groups and organisations have the relevant safeguarding policies and procedures, and that staff, paid and unpaid, have access to these. Again, as part of the Community Vision team, we offer a policy toolkit which includes all relevant policies and procedures that would be expected to be held by organisations. You can visit our Community Vision website, which will have a link to our policy toolkit where these can be found and you can completely personalise them according to your organisation. A further recommendation is that we make sure that all staff know who to go to with any safeguarding concerns. Usually this will be a designated safeguarding lead or officer, but sometimes some staff are unaware of who this is. We also recommend that organisations have not one but two designated safeguarding leads or officers, and this is primarily in the event that any of the issues, concerns or raised were in relation to that designated safeguarding lead. This allows staff another opportunity for somebody else to go and share their concerns with if they feel that it is inappropriate to take these issues to the person that the allegations may be around. A further recommendation is that when safeguarding issues are raised, that there needs to be consideration around any children residing in the family home or attached to the immediate family. We need to make sure that staff and volunteers are ensuring that they're asking whether there are children living in the property or accessing the property, and if this is the case, that they are referred to the relevant safeguarding organisations so that they can be safely responded to also. A further recommendation is that consideration needs to be given about reporting and sharing of concerns, particularly when a staff member is personally connected to the family or setting. Not only can this raise issues in relation to that person's connection to that family when that referral is made, but also you need to consider staff welfare and staff safety in the event that any referrals may place that staff member at risk. And finally, remember that all groups and organisations are responsible for safeguarding, even when they are attached to another setting due to their location. Regardless of where your group meets or holds their sessions, workshops, things like that, we all have a personal responsibility to make sure that referrals are made on behalf of those who are vulnerable. Another key issue, that children and families often receive support from a wide range of statutory and voluntary organisations. The support wasn't always coordinated, which could lead to confusion for both professionals and the families involved. So here are some of the issues that were raised in relation to this key issue. There was sometimes confusion or misunderstanding between voluntary and statutory agencies about their respective roles and responsibilities when it came to safeguarding children, young people and families. This sometimes could include a lack of clarity around what services are being provided to, by whom and to which family members. And this can be particularly in the case where you've got a family with multiple complex issues in relating to different members of the family. So for example, one parent may be receiving support from one service, another member of the family another parent may be receiving support from another service, and equally the children could be receiving support in their own right. either from an educational support service or another service across the partnership. So the issues where communication between agencies was sometimes limited and relevant information wasn't always shared. As part of the safeguarding training that we deliver, I always mention the fact that we all hold that one significant piece of the jigsaw puzzle, and actually it's not until we pull all those pieces together that we see the full picture. A further issue was that the expertise of specialist voluntary agencies wasn't always drawn on appropriately. For example, some statutory agencies didn't always benefit from the local insight held by local organisations into how to effectively engage with families and their community. And finally, another issue was that voluntary organisations weren't always included in child protection conferences, and local safeguarding agencies weren't always engaged with voluntary organisations, which could have enhanced the safeguarding response. So what recommendations can we draw from these issues? There needs to be clarity over who is responsible for safeguarding in the setting and what this role entails. Whether we're referring to a voluntary organisation or a statutory one, there needs to be clear knowledge of who is responsible, how that information is recorded, and how referrals are made into that service, ensuring that all the information, the right information, is being shared with the right people. A further recommendation is that all staff have an understanding of how and where to share safeguarding concerns. It's important that staff understand that whenever they feel there is potentially an issue, a worry, or a concern, no matter how small, that they know who they need to take that to and where that needs to be recorded. That ensures that the designated safeguarding lead is being given the full picture from all members of staff within a service or a group to ensure that they get an all-round picture of potentially what's going on in terms of safeguarding concerns around an individual or family. A further recommendation is that we ensure that all staff are connected to their wider safeguarding partnership. I've given an example there of how ourselves at Community Vision hold our safeguarding and domestic abuse forum meetings, whereby we bring together a whole host of voluntary and community sector organisations, and we connect them with our wider partners, but safeguarding children, safeguarding adults, and domestic abuse on a strategic level, so that we can ensure that information is being filtered throughout the partnership and any issues, worries, or concerns, no matter how big or small, are being shared. It also ensures that our safeguarding sector partners, particularly on a strategic level, have a good idea about what is going on in our sector, what support and services are out there, and how the teams within their safeguarding organisations can call upon this support as part of their plans and safety plans for children, families, and vulnerable adults. It also allows our statutory partners to share some of the strategic developments, themes, trends, and pieces of work and engagement work that are going on. We can share that with our wider VCFSE sector service, so that the views of the staff members, but also the members of them groups and organisations, are also being heard. Another recommendation is that your local statutory services should be incorporating the skills and knowledge of the community and voluntary sector into the work that is being delivered. And that is something that ourselves at Community Vision are really keen to promote throughout our projects and work that we're completing, and particularly within our safeguarding forum meetings. Sometimes, as it says there, VCFSE services and groups are often more closely connected to the families that they engage with, and we can have a greater level of trust and familiarity. So it's important that that is utilised as part of the work of the partnership. Again, where possible, partnership working should be employed across the sectors and services. Our next key issue is that voluntary agencies play a vital role in supporting families facing adversity. However, sometimes families were referred to services without a full understanding of their level and need. And some of the associated issues included a combination of rising demand and tightening budgets led to some areas to use voluntary services to fill gaps in service provision. Referrals for support from voluntary sector organisations were sometimes made without a full assessment of the needs of families and consideration as to whether a statutory intervention would have been more appropriate. Some of the other issues included that cases were sometimes closed to statutory services because children or families were receiving support from voluntary sector services. These decisions didn't take into account the level of ongoing need, and therefore sometimes this need was placed with a voluntary sector service who possibly didn't have the skills, knowledge, or authority to address some of the safeguarding issues that they saw. A further worry was that families weren't always able to access support from voluntary sector services, particularly those where they were referred to that were some distance away and weren't accessible by public transport or weren't open outside of hours, particularly those where the client attending or needing the service is in a 9-to-5 job role. A further and final concern was that voluntary agencies didn't always keep statutory agencies informed if children and families disengage from the services. Disengagement sometimes could lead to an escalation of risk or need. So what recommendations can we make based on this issue? So in terms of our own sector, our voluntary and community sector settings need to be clear about the role and responsibilities in relation to safeguarding, and we cover this as part of our safeguarding training. It's important that they have clear boundaries about where a case needs to be referred to or back to a statutory service for more specialised safeguarding support if the needs of the family or the individual go far beyond the role of the service. Another recommendation is that VCFSE services need to be clear that they do not have the statutory powers to safeguard, and where they need to, cases must be referred back to the teams so that action can be taken if need be. Given the rurality of the East Riding and that services cannot serve all areas, it is important that services do work in collaboration with one another and work together creatively to meet the needs of those affected by safeguarding issues. And finally, it's important that where a family disengages with a VCFSE organisation, that the relevant statutory and other service are informed of this. This may prevent the risks escalating with some families and allow our statutory partners to become back involved where possibly there's been a failure to engage with a service and address any risks or concerns. We're now going to look at some more generalised recommendations for practice. So in terms of child protection policies and procedures, it is important that voluntary organisations should have the strong child protection and safeguarding policies and procedures, and that all staff, paid and unpaid, should understand how to follow them. We therefore recommend that staff have access to and know where these are, and that all staff members, regardless of how big or small potentially their role is within an organisation, that they have completed the relevant safeguarding training and that this is up to date. Secondly, voluntary agencies should share safeguarding policies and procedures with children and families using their service, so that parents and carers should be fully clear of the responsibility of an organisation to share information where there are safeguarding concerns. All staff and volunteers should also receive safeguarding and child protection training, including understanding any specific risks that are related to the work that they undertake. So, for example, if you are a member of a youth organisation, it may be that you undertake additional safeguarding training in relation to contextual safeguarding and risks outside of the family home. This is also something that Community Vision is able to offer. Again, if you're working with families that are impacted by domestic abuse, we do deliver specific domestic abuse training, which comes under the Domestic Abuse Practitioner Standards Training. This comes in 3 different levels, with level 1 being open to any member of staff as part of an organisation. Please do contact me on the email address at the beginning of this session if you require any further training and support needs. And finally, there should be clear procedures in place for escalating concerns. Staff should be given the training and support to know confidently how they raise concerns and about the direction and overall management of these concerns if they need escalating. Next is some recommendations for multi-agency working. A full assessment of risk harm should need to take place before referring a family for voluntary support and consideration and deciding whether statutory support should be more appropriate. This will be undertaken by your statutory partners who will make a decision as to whether a case meets the threshold for statutory intervention or whether this might be better dealt with via an early help assessment, at which point the risks should be clear and evidenced will be within a safety plan how these are being managed and by what services, which may include voluntary and community sector services. Next recommendation is that voluntary sector should be part of the safeguarding partnership arrangements. And as mentioned, we do try to include all our VCFSE sector services in the work that we are doing as a wider partnership. Next, all agencies working with a family should have direct communication with each other. Voluntary organisations should proactively engage with local safeguarding agencies and other organisations involved in child protection. It's therefore important that if you are aware of a member as part of your group or organisation that is connected to a statutory service, that you have had the relevant conversations to introduce yourself and inform them of the role that you play in that child, young person or older adult, or vulnerable adult's life. It's helpful to assign a lead professional to coordinate work with a family and ensure that everyone's roles and responsibilities are clearly defined. Voluntary agencies should follow up on any child protection referrals they make if it seems that no action has been taken or the risk to the child has not been managed. So in terms of the lead professional, if a case is referred to safeguarding services, generally a social worker would become. However, if that case does not meet threshold and is not picked up and allocated to a social worker, that lead professional may be a member of a voluntary or community organisation. It is important, as mentioned, that should referrals be made, if there is no outcome or you don't believe that the necessary actions have been taken to safeguard that child, young person or vulnerable adult, that you chase up on that referral and check if any action has been taken. And finally, children's social care should maintain a list of voluntary agencies who are working directly and regularly with children looked after. These agencies should be called on to provide a report for the looked after child review, and a copy be sent to the child's updated care plan after each review. And next we have some recommendations in relation to record keeping and information sharing. Voluntary organisations are required to gather, record and share information about any safeguarding concerns. And generally this information will include the date, the time, who was there, what was said, and any actions taken. That includes a recording of any referrals made or actions taken in terms of trying to safeguard that child, young person, or vulnerable adult. Voluntary organisations should routinely request information regarding the history of family and previous and current agency involvement. This can, particularly when accepting referrals for support from statutory agencies. This allows them to approach any work with that individual or family with that insight into what the concerns are, what has already been done to try and manage those, and also can allow families to avoid having to re-go over information multiple times and kind of re-trauma in a person, particularly if they've been through a difficult circumstance. Next, voluntary organisations should inform the referring agency if a child or family is not engaging with the support they offer. Sometimes, as part of a decision to close a case, the decision is based on the fact that the individual or the family is engaging or meeting with certain criteria. And should that criteria not be met or then referrals not be followed through, it can mean that the decision is made to reopen a case. So ultimately, it's of great importance that we do keep our statutory partners up to date on the engagement, on lack of engagement from an individual or family. Next, voluntary agencies' case records should include reasons for any gaps in service provision. So where they're unable to meet a need or meet a potential action within a safety plan, it's important that we're able to explain why. And as mentioned in an earlier slide, that simply could be that unfortunately that individual is not able to travel to other areas or parts of the East Riding where specific forms of support are delivered. And finally, voluntary agencies providing services to adults who are parents must consider the impact of the parents' problems on their ability to care for and safeguard their children and share any concerns with relevant agencies as they arise. So, for example, if you are working with a parent who you know has used substances that may impact on their ability to parent and care for a child, particularly a young one, it's important that we do consider that impact, any risks to the children, and whether a referral is necessary in terms of making sure the children in that home are safe. I picked this quote from the document because as much as this webinar is focused on the needs and requirements of our sector in order to really enhance the way we safeguard children, young people and vulnerable adults, I think it's important that also agencies, particularly those watching this, recognise that all agencies can benefit from drawing on the trusting relationships and specialist knowledge held by our voluntary organisations, voluntary and community organisations and agencies. I think we do some incredible work along the sector, and quite often we can be best placed to fully understand people and their situations. And we are by far probably the most consistent factor in anybody's life. You know, they may have multiple periods of intervention from services, but will also are likely to experience differences in workers, health workers, support workers, etc. Whereas those that are working closely with a community can quite often be that consistent form of support for them. So in terms of local child practice safeguarding literature and resources, I have shared some links there that take you to our East Riding Safeguarding Children's Partnership. And there is a link there also. We can send these slides out. Please do contact me on the email address and I will send these slides out for all the links. And on our website, the ERSCP one there, we have our children's safeguarding practice reviews, and they make recommendations in relation to some child practice safeguarding reviews that was done in our area. And again, the final link there is to some of those cases where there is specific exploration of specific families and the findings and recommendations that came from those cases. And finally, it's a huge thank you from me for joining in this session. I do hope it has been useful. And again, if we can provide any safeguarding or domestic abuse training and support to your organisation, please get in touch with me at gemma.jennison@communityvision.org.uk. Thank you.